If there's anything we've learned, I think from responding to past infectious disease, either epidemics or pandemics, is that the response needs to be multi-sectoral and intersectoral. For example, if we are talking about developing anything as a cohesive response for COVID-19, it cannot just be lab science, it cannot just be clinical science, it cannot just be public health approaches. It also requires you to work with sociologists, with anthropologists to try to understand how communities understand infection, how infection spreads, how you can work with communities to enhance community engagement, participation in research, and also how to then talk about uptake of anything that you might come up with, which is either a public health intervention or it is a biomedical intervention, whether that be a vaccine or drug. If there's anything we've learned from HIV, it's the importance of actually having all of those approaches and working closely with communities. You can have a magic bullet, but that magic bullet will not be effective unless people actually are willing to take it, right? And it's the same with the efficacy of any public health measure like containment or mitigation or lockdowns. Only if people understand why it is important to take those steps and they agree to adhere to those by being convinced about it, will you actually have success. So the kind of issues which are still being reported of people sometimes not adhering to the advised public health measures indicates that there is some kind of a lack of clear communication or understanding, and that is something that working with experts in that domain, whether that be health communications or sociologists or people who are experts in community engagement, can help. Now, similarly, as you are rightly pointing out, there is a lot of tech, the advantages of technology as well as biotech, which can be leveraged